All right, here's two simple ways you can check the stability and strength of your ankle. One, by looking how you walk and see if we are pronating the ankle, which is not the correct way to walk. And then we also want to do one leg balance and see how stable it is. And that's also going to test the glute mediuses. So I'm just going to turn around from the camera and walk. I want to show you how you should walk. The outside of your heel should land. You should come off your big toe. We talk about having 60 degrees of toe extension there. And so you should walk like this, and my knees stay straight, my hips stay level, like that. Now I want to show you what I see in a lot of people is their ankle turns in and they land on the inside. If you watch, see how my knee, I'm exaggerating a little bit, but it just dips in there. And then to do that, my hips got to compensate too, like that. So if you do that, we want to work through the ankle stability exercises and videos, and you're going to find that many people, probably you, walk like that a little bit. You might not exaggerate it, but it's just really common. I see it 9 out of 10 people that I test. Um, so we got to work on getting those ankles out like this and landing correctly on the full part of the heel, a little bit more on the outside, the lateral side, and then coming off on the big toe. Again, I find most of my knee problem patients, knee pain, gets corrected by fixing the ankles. Next thing I want you to test, and to do that, you just need a camera or have somebody film you. Take a hallway down the house or at work and just walk down and look at yourself going forward and coming back. And then what I do is put it on a really slow motion. So I pause the video and then just glide it really slow and just watch your ankle. And what you're looking for is it landing on that inside, and you'll see the ankle kind of twinge a little bit like that, where it goes in like that. And as that goes in down there, my knee has to go in like that too. So from the front, it's going to same thing. You're going to go like this. It might not be that exaggerated, but you'll see the hip too. And usually you'll see if one side is worse than the other, you'll see kind of a compensation up in the hip. So you won't see them moving evenly. You'll see one hopping higher or popping out a little bit more too. Now, the second way to test the stability and strength is to go up on one leg and try to bring this up over to 90 degrees. And you're just looking for that ankle. And when it's weak, you'll see it shake like this. And then you'll also see the hip. So we're also testing the stability of the smaller glute muscles. So your ankle might be stable, but you might be falling this way. So then you need to do our glute strengthening exercises to rehab that. And look for exercises for the gluteus medius and minimus. But you're going to go up here and just watch for that ankle. And we're looking for it to pronate or turn in like that. And again, you'll see your knee usually go in there with like that too. And the goal is to be able to stand like this for 30 seconds. So if you know you have bad balance, be careful, maybe not do this, maybe to get an idea of how far you can do it, or have a wall or chair there to hold on to real quick, like that, all right? So try these out. If you do find you have pronation or instability of the ankle, then we need to strengthen those. Also commonly is to have flat arches. So if you stand up straight, you usually find you should have a finger and a half in there. So I should be able to go there, put one finger in and then one on top of it halfway, and that's what your arch should be. So again, if with a flat foot, you're probably pronating most of the time too. So that can be strengthened, and we'll show you some videos on that one. Hopefully this helps, and do this test and see how you're doing.